Good day, everybody. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and today in this video we're going to be talking about the differential diagnosis. So this is a very important thing. This is really what your years of preceptorship in your training are all about. Whether it's a medical student, a PA student, nurse practitioner student, is honing in and gaining the skill to take a patient complaint, a well-collected HPI, and form a differential that hopefully will include the correct answer. The whole idea of a differential is to take those two pieces of information and have a wide array of possible causes for what might be going on, and hopefully a wide enough and a knowledgeable enough array that whatever the correct answer is, it's in the differential. Because if you have something and the correct answer isn't in your differential, then you're probably not going to arrive at the correct answer. So developing that knowledge base as far as differential is very, very important. There's a couple different ways to go about forming a differential, and it kind of changes a lot as you progress in your skill set as a medical primary care provider. When you're initially starting, you want to try to do the more comprehensive formation of a differential, because you want to limit the chance of not having the right answer on your list. And as you get more and more experience, then you can kind of, do that in a more condensed way. One of the most comprehensive ways to come up with a differential, and I mentioned this just briefly in one of the previous videos about the review of systems, is doing like a head-to-toe differential. So you get your chief complaint, you get your review of systems, and while you're doing that, you're thinking, what are all the things that I'm aware of that could be a cause for something like this? Okay, and you start, and sometimes it's easy to start, well, let's just start at the top of the head and we'll work our way down all the systems of the body to come up with a differential. Now, when you do that, you can come up with a very broad differential. So later on, when you're more skilled, going through the entire system and every differential for every complaint is going to be a bit exhaustive, and it's going to be probably more time consuming than it's worth. But when you're initially starting, that's one good way to go about forming a differential. Okay, so we could think of maybe an example. Let's think of, I think I used the example before of lower extremity edema. I think that's a pretty good one. And so someone comes in and their lower extremities are swelling, and so you get a history, you find out it's been going on for whatever amount of time and all that kind of stuff, and so you're thinking, okay, what might be causing this lower extremity edema? One way to go through and put a list of all the things you can think of, hoping that the right answers on that list would be go top to bottom. So is there anything brain related inside the head that might cause lower extremity edema? And then you could think of some things, even if they're kind of weird and strange, you could do that. So you could think of hormone secreting tumors maybe, or something that might do it, and you could think of those things. You kind of come down, anything in the neck region that could cause lower extremity edema. And you might think, oh, you know what, the thyroid is right there. If there was a low thyroid, that could contribute to some swelling. So maybe you'd have hypothyroidism on your list, and then you come down and think, okay, how about the cardiac system? Anything there that could do that? Like, sure, I mean, heart failure can certainly cause lower extremity edema if the heart's not pumping as well as it should. Lower extremity edema can certainly involve the lungs, which is kind of connected with the whole heart failure. So you can think pulmonary, is there anything there? You move on down, how about GI? Is there anything GI that could cause a lower extremity edema? It's like, well, yeah, kidney failure could certainly do it. Liver failure could certainly do it if you're having liver disease. And so you would certainly kind of look at those things. You could have, if there's a lot of obesity or like an abdominal mass pinching off one of the veins, returning fluid from the legs, that could lead to lower extremity edema. So those would all be things you think of. You go down to genitourinary. What are things there that could cause lower extremity edema? How about musculoskeletal, and so on and so forth. And if you go through that way, you'll have a pretty large list of possible things. Chances are, whatever is causing the lower extremity edema is going to be on that list. And like I said, once you get more experience and you see things more and more often, then you can oftentimes dispense, especially with a good history, you can dispense with the more rare things and not have to do such an exhaustive list every time. The other thing about differentials is it becomes in some ways automatic, especially for common primary care bread and butter medicine, which is what we're talking about here. So there's always those weird things, those weird complaints that don't fit in like your usual everyday. And when you have one of those, oftentimes it's good to say, you know what, for this one I'm going to go head to toe and see what's going on. Most of your bread and butter primary care, you can get a differential pretty quick once you have some experience doing that. So the way I usually look at doing my differential is I want to kind of do it in two different ways. So first, what's the most dangerous thing that could cause this? So we make sure it's not that. And then most common. Because you can usually, when you form a differential, you want to do kind of from top to bottom what you think is most likely down to what you think is less likely. Another way to do it is what's most dangerous down to the more benign type of things. So usually when I see someone with lower extremity edema, unless there's some really strange other symptoms, I don't consider tumors and that type of stuff and abdominal masses right off the bat. Right off the bat, I'm going to think of, well, most commonly, lower extremity edema is going to be something about venous insufficiency, the heart, the liver, the kidneys, or the thyroid. And so, boom, there you have it. That's your differential. And so then as you go through your review of systems, you can ask about those things. You ask about any sort of thyroid symptoms that they might be having. You can ask about any sort of heart symptoms they might be having, any sort of kidney or abdominal symptoms with the liver that they might be having. And then you use that review of systems to kind of get through your differential and sort it out. And then hopefully once you're more experienced, you can go to your preceptor, you can give them your HPI, give them your review of systems, go through what you found in your physical exam, and say, I think that most likely this is probably either thyroid, heart, liver, kidneys, or venous insufficiency. Here's the things that support or don't support each one of those. Given that, I'm going to get this information to find out what I'm missing, and off you go on to assessment and plan, which we'll be doing in the next video. So differentials, like I said, when you're first starting, they're going to be long and broad. Go head to toe if you need to, so you make sure you have the right thing on the list. And as you gain experience, then make sure you think about, well, what's the scariest, most dangerous things that could cause this, and then what's the most likely things that could cause this, and then those two lists are usually the ones I kind of work off for the most part when I'm forming my differential. So I hope you're having a great day, and we'll see you later in another video.